So here I have given the third classification, which is the direct acting vasodilator, which is directly vasodilating your blood vessels. And if you know, if our blood vessels are dilated out, then it's mean our blood pressure will decrease. So it contain three types of drug having different mechanism, but they are doing the same thing. Mean they are dilating your blood vessel, but through a different mechanism. Three drugs which are used in it. The first drug is hydrazolazine, second is minoxidil, and third is nitric oxide. You can say organic nitrates, which we have also discussed when we are discussing the angina pectoris, because they also need there to treat the angina also. So the first drug is hydrazolazine. We also have discussed hydrazolazine in the angina, because they are here we have concluded it in the calcium channel blockers, but actually it is not a calcium channel blocker. It block the function of the calcium. So how it is doing that work, so let's consider it. So first, the kinetics, we can give these drug orally, but sometimes the orally the liver can affect the metabolism, so therefore we can give IV through the IV route. And they are very good for the emergency case, like if your patient came who has very emergency case, whose blood pressure need to become down and should so hydrazolazine can be given out in that case, because hydrazolazine has very rapid onset. So in emergency case we need a drug who has rapid onset, so you can give hydrazolazine. An indication, it can be given to a pregnancy and can be given in the case of angina also, we have which we have discussed. So how, what is the mechanism? So actually it doesn't consist of only one mechanism of action. Actually it consists of many mechanism of actions. Like the first mechanism of action is from the lipid, the enzyme is acting on it, which is called as phospholipase C enzyme. From the lipid, this enzyme is acting and producing phosphatidyl inositol 4,5 bis biphosphate. After the production of it, it divided or cleavage into the two groups, so you can say two chemicals. First is the diacylglycerol and second is the inositol 3 phosphate. So inositol 3 phosphate bind to the receptor which is called as IP3 receptor present on the endoplasmic reticulum. And in every cell endoplasmic reticulum is present, and in the endoplasmic reticulum the calcium are stored out. So whenever the IP3 bind with that receptor, these storage of calcium will released out. And due to its release, whenever whenever the calcium is released out, it will cause the contraction. And whenever the contraction happens, your blood pressure will increase. So we have to inhibit it. So what your drug hydrazolazine is going to do, so it will not allow the binding of IP3 on its receptor, so it is inhibiting this step. So by inhibiting that, now the vasoconstriction cannot happen, now the blood pressure cannot increase. Second mechanism of action is that when the drug is given, it stimulates the endothelial cells to release the nitric oxide. One concept you should remember, that in every natural cells, the endothelial cells release nitric oxide. But if a patient who's has some damage in the endothelial, now his endothelial is not releasing the nitric oxide properly, so then we will give this drug to him. So this drug will stimulate your endothelium to release nitric oxide, and whenever the nitric oxide release, it is a very good vasodilator. How it is stimulating an enzyme which is called a GC enzyme is responsible for the conversion of GTP into cyclic GMP. Cyclic GMP activates protein kinase G, which cause the dephosphorylation of monosin phosphate. So whenever there is a phosphorylation of monosin phosphate, it will attach to actin filament and cause the contraction. But due to dephosphorylation, this phosphate group will break up this bond. Now your myosin cannot attach with the actin filament, and contraction cannot happen, and the blood pressure will decrease. Third mechanism of this drug action is that this drug can cause the potassium influx. Due to potassium influx, it can cause the hyperpolarization of your membranes, causing decrease in the contraction and decrease in the blood pressure. What are the adverse effects of that drug? They can cause reflex tachycardia, means increase in your blood pressure, decrease in your blood pressure, but increases your heart rate. Because whenever the blood pressure is decreases out, this will be sensed by your heart. As a result, your heart sense it and increase your heart rate. So as a result, these two opposite mechanisms are happening. Your heart rate is increased out, because tachycardia word mean increase the heart rate, and your blood pressure is decreased. So this is the adverse effect. Palpitation mean happens because a severe kind of sweating can be occur in that patient. Flushing can happen. The redness of the face are the adverse effect which seen. And the last adverse effect is the drug induced leucus like syndrome. This is a syndrome in which what is it is an autoimmune response in which body destroy its own self. So body is begin to produce special type of antibodies which is destroying his own natural cells. So your own antibody consider your normal cells as an antigen. They will go bind with them, causing the agglutination, and as a result your body is going to consume itself and the death will happens to it. So this is a very rare adverse effect, not happening in every person, but it is a rare case happening in about 1% of the people. Now the second classification of the drug is minoxidil. Minoxidil, its mechanism of action just similar to the third mechanism of hydrazolazine, that it causes the potassium influx, and whenever it causes the opening of potassium channels. Due to this opening, the influx will happen out, vasodilation will occur, and BP will decrease. But it has its adverse effect is that it can cause the thinning of your skin and your mucus, and it also increase the hair growth. Hair growth increase is very beneficial effect when you are spraying it in your head, but it can cause and leads to hair growth whenever it's sprayed out, like in on your body. If you spray it out on your like if you are taking with the oral tablet, so it increase the facial hair growth. So therefore it is very not good effects for us. So what are the indications? So we can give these drugs to a patient who have high blood pressure and who have male bleediness, means some kind of person, especially the male person who have bleediness in them. So we can give these sprays to that person so that their hair growth can occur. Last drug classification is organic nitrates. They can also be given in the case of angina. Two drugs are here, nitroglycerine and sodium nitroprusside. Nitroglycerine is cannot be given through the IV route. It can only be given through the sublingual route because of its poor absorption. Second, sodium nitroprusside can also be given, but there is a side effect of sodium nitroprusside. Its mechanism is just similar as we have explained earlier as this second mechanism. Indication can be given to hypertensive patient or can be given to the angina patient. Toxicity, it can cause cyanide poisoning because in this drug sodium nitroprusside cyanide group is present, due to which the poisoning can happen when the toxicity when you take that drug for a prolonged time, and the symptoms are headache, confusion, dizziness, and nausea will feel out. So how to treat that poisoning? So we will give sodium thiosulfate and hydrocobaltamine in that. So how they are treating? They will react with the cyanide group. So cyanide group will react with the thiosulfate, sodium thiosulfate, and inactive metabolite are produced like thiocyanate will be produced. So thiocyanate is very less poisonous or very less toxic, so it will release out through your kidney. Second, the cyanide will react with the hydrocobalamine. Hydrocobalamine is a type of your synthetic vitamin B12. So it will react with it and produce an inactive metabolite which is called as cyanocobalamine, which is very less toxic and it will release out through your body. So this was all about the today's lecture. I hope that you will understand this video. If you like it, then please subscribe to my channel. Take care. Allah Hafiz.